Hey guys, Brett at Barbell Therapy here. Today we want to talk a little bit about what is telehealth, how does it work, is it right for me, and is it something that's going to be worth my time, effort, energy, and financial cost. There's a lot of stuff out there right now with the coronavirus about physical therapy and other professional healthcare providers switching to this remote type service. So what we're going to go through today is a little bit about how it works, and is this something that could work for me, and why is it something that could work for me? So the biggest question we always get here at Barbell Therapy is, well, if you're a physical therapist, don't you need to put your hands on me to get me better? And the answer is no. So most of our patients we practice with a self-empowerment model where we do our best to wait to put our hands on you. So when you come in for an evaluation, regardless if it's in person or remotely, we're doing everything and finding everything first that we can send you home with that day, that you can start to self-manage your pain and injury. On top of that, the big thing with manual therapy and putting our hands on you as the patient is that is a small change that lasts for a maybe 24-hour period in time, where our long-lasting effects are going to be from doing certain exercises and resets and really teaching you what you can do at home, because most of our patients we only see for an hour at a time anyways. So the big things come from teaching you how to understand your injury, how to work around your injury, and how to rehab that injury on your own. And those are all the things we're doing with telehealth. So how do you know if this will work for you? So with everything changing right now in our business model and in the world, what we're doing is doing a free consultation with patients to set up a remote consultation through one of these platforms, and we're going to go through and screen you and see what the past medical history is that you have, how this injury started, what the pain feels like, what things are aggravating it, what things make it better, and from there we're going to determine, before we ever charge you or put a cost on things, is to determine if remote physical therapy is even right for you in the first place. So how does that all work? So if we do determine that the injury or pain that you're feeling is something that could be appropriate for a remote telehealth treatment approach, then what we're going to do is do a full evaluation where we're going to put you through and have you yourself go through different movements and positions and find out what different things are triggering the pain and what different things are giving that pain some relief. And from there, we're going to really get to the source of why this has happened to you in the first place, what we can do in the present to calm those symptoms down, and how we're going to progress in the future to make sure that this injury doesn't come back. So once we have our findings of getting to the source of the problem, what we're going to do is set you up with a customized home program that's going to help you resolve your injuries on your own. So that's going to include some different drills and maybe neurological resets and different things we practice here with patients anyways. When we meet in person, we can do the same thing virtually, and we will send you videos on how to do them. You can send us videos back of you doing them. We can do that right through the computer, and we're going to make sure you're doing them correctly and that you're doing them as frequently as you need to. And that's where we're going to start, is getting those symptoms down through some self-help techniques, whether that be, repeated side bends or something like that we would give a lot of our patients, or showing you different areas that you can self-massage with a foam roller or with a lacrosse ball, or some different stretches and techniques there. For many of you that are also active and athletic individuals, what we're going to do is customize a full workout program for you to make sure that we're not exacerbating the issue and making it worse by kind of poking at that scab, and making sure everything we're doing is progressed appropriately. So we're looking long-term here with how can we not only just work through this injury, but build this robustness where you can come out of this experience knowing how to manage it on your own, what to do, and how to make sure this doesn't happen again. So we're going to give you a full training regimen, not just based around the injury, but for your whole body, especially with these times when we're working out from home, we have limited resources. We're going to give you everything we can to make sure that you can train effectively at your highest level and not feel any pain. One of the other most common questions we get is, well, do I need a referral to do this? And the answer to that is no. If you live in the state of Massachusetts where we practice, you do not need a referral. We are a direct access state where you can come right to physical therapists and reach out to us. So you can visit us on our website or shoot me an email that's listed on the website, and we can get you going that day and start your treatment and help get you out of pain and getting you back to what you love.